You're back at the Faculty Factory podcast, and I'm Kim Skarupski looking at my friend Adam Wolfe. Good morning, Dr. Wolfe.
Morning, Kim.
Folks, Dr. Adam D. Wolfe, he's been here before. He's a frequent flyer. 2 other episodes. Number 320, Self-Promotion and Other Challenges. And then episode number 326, Key Communication Strategies. Today's conversation proves to be just as interesting. Wait here. Dr. Adam Wolfe, he is an associate professor of pediatrics, the program director for the Pediatric Residency program, and assistant dean of medical education. He holds the Jann L. Harrison Endowed Chair in Pediatric Graduate Medical Education at Baylor College of Medicine, San Antonio, CHRISTUS Children's. Adam, I just love seeing you on the podcast. You're laughing and smiling already. Just occurred to me, I'm going to invite him to be one of our leading international speakers at the upcoming early career, mid-career boot camps for leadership.
Oh,
Look at he went, ooh,
I didn't know that. No, that was fresh to me too.
Oh yeah,
Okay. How can
we're
I say no
gonna
now
get
that
you.
you've done that publicly? Yeah, okay, sounds good.
We're gonna get you. He's that good, and I love him so much. Okay, Adam, what's on the docket today? Take us away.
Well, today, thanks, Kim. First of all, it's great to be back. I appreciate the invitation. That now multiple invitations, I guess. I wanted to share with you some thoughts about peer mentoring as faculty members specifically. I thought about this when we did the first podcast together. I guess it was the one you said was 320 about self-promotion. One of the questions you asked me toward the end of that was, how do you get residents to support each other when they are learning how to promote themselves for a job application or a fellowship application? And one of the strategies I threw out there but didn't elaborate on was they should be mentoring each other. And we do have some experience with that at the faculty level, and that was what I wanted to share with you today.
Perfect. And I know not only are you all talk, you're action, because this is a peer-reviewed publication in our preeminent journal. Tell us about that.
Yeah, so we did publish our peer mentoring experience in academic medicine back in 2023, but that represented about 5 years worth of chronology before we got to that point. So if it's okay with you, I wanted to describe a little bit about how we got there, because what we did might be a little bit different in terms of our needs assessment, but what we learned, I think, is very generalizable. When we started here in San Antonio, so if you're familiar with Baylor College of Medicine, obviously very large, very well recognized medical school in Houston, Texas, which is not far from you, and it's not far from me, but neither of us is actually in Houston. Baylor came and formed a partnership with CHRISTUS Health probably about 11 years ago, 12 years ago now. And through Baylor, they didn't just bring faculty from Houston to come staff the new children's hospital here in San Antonio. They hired 170 pediatricians from all across the specialty within a year of each other to start a brand new faculty under Baylor here in San Antonio. I was coming right out of fellowship, and I'm glad nobody convinced me that that was impossible, because it really sounds impossible in hindsight, but they did it. It was really a fantastic effort. And we all came here and started within 1 year of each other, 2013 to 2014, to form a new faculty 200 miles away from our academic leadership in Houston. And there were a lot of things we learned along the way, which could be multiple other podcast episodes, actually. But one of the things that we found was that with more than probably 80% of those faculty being brand new, like within just a few years of their terminal training, we didn't have a core group of more senior faculty or more experienced promoted faculty who could mentor us. I'll say us because I was one of them. And I don't think that's a flaw in the way we were recruited, but I think that it, in hindsight, was a challenge that should have been anticipated, but we didn't know. And what that meant was there was only one faculty member in the entire group here, which was our department chair, who had actually been promoted through Baylor's process. Anyone else who came here had not had experience as a faculty member at Baylor. And so A few years into that enterprise, there were a number of us who were publishing, we were doing education, we were having excellent clinical experience, and we were getting ready to think about promotion, but there wasn't as much in the way of direct mentorship, boots on the ground here. We had access to people in Houston who could help us, but it's not quite the same as having people you can sit down with in their office or have a cup of coffee and really hash out how you're going to plan your promotion. So our needs assessment, as I just described it, is probably pretty distinctive. Most institutions won't necessarily relate to that, although there are places creating new community-based faculties throughout the country with a remote academic affiliate. So it's not entirely unique, but it is unusual. And what we did was I reached out to the head of the person who was the head of faculty development at Baylor at the time in 2017, and we did a little needs assessment among our faculty here. We did a survey that had maybe like 30 or 40 people replied. So not by survey standards, I guess that's not an unusual response rate. And we found that people really, they didn't lack for ambition and they didn't lack for accomplishment. They just lacked for mentorship, which wasn't a huge surprise. So we brought three of our faculty development leaders, two from pediatrics and one just from main faculty development, out here for a whole day. We did an in-service day in 2018. And we spent the whole day with a handful of faculty who were able to free up that time, which isn't exactly easy. And we spent the whole day talking about strategic planning, about promotion process, about awards you might apply for, how to build a portfolio, and then a lot about sort of the psychology of promotion, growth mindset, and self-determination. And coming out of that, we decided we were going to assemble a peer mentoring circle. And we built that peer mentoring circle out of the 12 people who decided there had been more people at the in-service, but 12 of us decided we really wanted to commit to at least a year's worth of working together to support each other's efforts at career development.
Adam, could I interrupt just,
Sure.
sorry, 1 second, because I can't help but think of experiences around the country where, as you pointed out, the model of systems merging is not necessarily new, where hospitals acquire other hospitals, and my experience at Hopkins, like many institutions, our footprint would grow because this hospital would all of a sudden become part of Hopkins and this one and this one, and we would inherit a group of clinicians, physicians who would then become faculty, perhaps, and that kind of raised a whole new bucket of worms, if you will, because people back at the air quotes I'm doing here mothership were like, wait a minute, wait, they're now faculty and they're making 3 times the amount of money we are, because before this they were in private practice and they weren't part of Hopkins, and now our salaries are super low and we have to do all this other stuff. But they don't have to do all this other stuff like education and scholarship and research. And wait a minute, what? And so I think the way you're describing this, Adam, is that you started with a clean slate. There were no faculty. So my question was, the faculty you recruited and had this wonderful all-day in-service experience, did they understand and appreciate that they were now academic faculty, academic health people, and were some of them thinking, no, I'm a pediatrician and there's a new hospital. This is cool. I want to do my clinical work. How did that promise of academic health, that uniqueness of us and academic health get communicated to, or how did that match up with your new faculty? Sorry.
Yeah, that's a great question. And I think I made the assumption that our experience is everyone else's, but you just described a completely different one. So yeah, to clarify, the faculty that came here specifically were hired new. So they were not previously practicing here because there wasn't a children's hospital here at the time. They weren't previously practicing here in private practice and then hired on as academic. There had been a pediatric group here with another academic affiliation prior to us coming. Before it was a children's hospital, it was a pediatric within an adult facility at the time. And some of those folks did take jobs to stay here, but they were already academic. There were some private practice pediatricians who signed on to join our faculty, but they knew they were joining an academic group. And many of us who traveled here after our training, which was a lot, like at least 70% of the faculty were coming right out of training, they were expecting it to be an academic experience. So we didn't have that challenge that you described where people had a big paradigm shift in what they were expected to do. The people who came here actually, I think the vast majority of them came here wanting at least to be teaching within an academic mindset. And many of them expected to be doing either research or scholarly quality improvement work as well. I think that's a really important distinction. And you know, the other thing that you mentioned just about thinking about the academic mindset, most institutions that do academic promotion are expecting their faculty to excel in more than one pillar of the mission, right? So you have most places will include clinical expertise as one, but then expect you also to be excelling in a second pillar of research or maybe education, service, leadership. It depends on the institution. And Baylor is no different. They have those expectations. Interestingly, after forming this satellite, or I guess we called it a satellite, but an affiliate site here, they created a single mission pathway for us. So our faculty actually could be promoted with clinical excellence as a single pillar contribution. However, the portfolio for that incorporates a lot of stuff. So they added expectations that it's not you're taking care of patients only, but you're taking care of patients and you have service line development, you have quality improvement work, you are teaching within your clinical settings. Like they incorporated bits of the other mission areas into a single pathway. So we do have a few things here that are sort of unique. So when I talk about peer mentoring, some of the things we did with our group are going to be specific to our institution. And I think that there are some lessons learned that, like I said, could be more generalizable.
All right, I feel like I could go down about 15 different rabbit holes with you right now, Adam.
I agree. Yeah. Oh, yeah. I'm trying to stay focused, but there are so many things we can talk about. I
want to get to that paper because this is the cool thing.
So let me describe so the way the paper is organized is really, I think you can distill out 8 specific tasks that you would need to do in order to form a peer mentoring circle. And I'll describe how we did it, but just to summarize them up front, you would need a needs assessment, which I described. You have to know what you're trying to accomplish. You need to figure out what your framework is for how you're going to develop your peer mentoring circle, which I'll describe for what we did. You need to figure out the roles and responsibilities of the people who are going to participate and lead. And similar to that, you need to have norms and core values that help guide everyone in the same direction. That's very similar to strategic planning. Then you need some way that you're going to store the hive mind of the group. So some sort of documentation or repository. You need to make sure everyone, I think the first thing you have to do is make sure everyone has a CV that's clean, formatted, and up to date. Then you can get into, and this is where you individualize by institution, you can get into the pillars of your institution and the specific portfolios that people are going to develop. And then at the very end of whatever your process is, or along the way, you need a process for evaluation. So that's 8 steps. I will summarize for you how we did those things for us, and these are also in that paper as well. I mentioned how we did our needs assessment, which was really the survey we did in 2017, and then we gathered more information from the group that participated in our in-service in 2018. And then we pulled that group of 12 together, and the framework that we actually chose 2 frameworks. One is more procedural and one is more conceptual. So the framework that we chose that was procedural was we were really guided by a paper that was published back in 2017, not in medicine, by 2 psychologists at the University of Massachusetts who looked at peer mentoring within engineering for women faculty. And what they were trying to do was address the question of why do people leave our field without getting promoted? So why are people either stagnant in their career development or choosing to go? So they looked at the issues of both success and retention, and it was specifically about women in engineering. What they found was that peer mentoring circles where there were lots of people in the same boat, so in that case, women in engineering mentoring each other, they saw demonstrable improvement in both success and retention of those individuals. So we actually used that paper as a framework for how we wanted to structure our peer mentoring circle, not specifically for women, although it's pediatrics, 70% of us are women. But we wanted to use as the common thread the fact that we were all somewhat new to academic medicine as faculty because we had just come out of training or out of private practice or wherever we had come from. and wanted to support each other, again, for success and retention. And then the other framework that was important for us, and it's probably my favorite framework in education as well, is self-determination theory, right? Which I think most of us are probably familiar with, which is really the idea that if we have control over what we're doing and we feel autonomous and we feel engaged and the work we're doing is meaningful, then we're more likely to be satisfied, successful, and well. The wellness part is important too. That's the way I design curriculum. That's the way I mentor. So I was happy to see that our group sort of chose this as well. And so that was the framework piece that we wanted to be guided by.
Folks, the name of the article, it is entitled Outcomes of a Peer Mentoring Circle, an Innovation to Improve Academic Physician Career Advancement in a Community Hospital Setting by Ruchi Kaushik, Tracy McCallan, Daniel Cedillo, and Dr. Adam Wolfe, MD, PhD. So it was in Academic Medicine, February 2023. But continue.
Thanks. Yeah, I think it's also important to specifically call out Dr. Kaushik on that. So she was the other instrumental individual in sort of leading this group. And that kind of gets us into the next part, the roles and responsibilities part. So originally, and I'll just admit that we learned from what didn't work. Originally, we thought, oh, there's 12 of us in this peer mentoring circle. We're going to meet every month, and we're just going to rotate who's in charge. There will be a new leader every month, and that person will set the meeting and sort of lead the agenda. And
No.
that did not work real well. Well, again, with the kind of that self-determination idea, maybe it was just a little bit too ambitious to say, oh, we're all going to be equally able to lead the group. And that's not what wound up happening. So I will say Dr. Kaushik was, again, instrumental in sort of pulling us together and saying, okay, we're all equals in this group because we all want to accomplish the same things together. Yet there will still need to be somebody who's kind of in charge. So she and I sort of co-led. We traded off taking responsibility for each meeting. And I think that was more helpful. So again, when it comes to the roles and responsibilities step, it's a matter of whoever the group is that's peer mentoring, agreeing realistically to what people can contribute in terms of their time. And then I think you do need to identify a leader or a couple of leaders who are really going to maintain accountability for the whole group, just to make sure the meetings happen. And so that was something that was important to us. I think another group of different individuals might come to a different conclusion or strategy for that, but that was how we wound up doing it. And the other piece would be responsibilities. So this is different from leading a group where there's a deadline or there's a shared task that has to be completed. So I'm not leading an interprofessional team to take care of a medically complex patient. There, everyone has to pull their weight on a certain schedule in order for the end goal to be achieved. With this one, we had to have two kind of opposing ways of looking at each other. One was we all wanted to achieve progress toward promotion, either get promoted or make demonstrable progress toward getting our first promotion or our next promotion. On the other hand, we had to be able to give each other grace that no one cares more about an individual's promotion or career path than they themselves should, right? So I, as a leader of this group, could not take it personally if someone didn't show up or didn't finish their CV edits on the schedule we had agreed to. They have other things to do. And if their schedule didn't permit it, then there is no one else who needs to be accountable to that except for them. And we don't have to. So it's different from leading a group where I need to keep everyone on a task and on a schedule. And so it was an interesting experience because to me, it's a different kind of leadership where.
And it's not because, hang on a second. And it's not that they're not doing their piece is holding the group back in any
Right.
true way. It's, hey, if you didn't do your writing, like in my writing accountability groups in the WAGs, hey, if you didn't do your thing that you said you're going to do, it's no, we're not waiting for your piece for our grant or your piece for our paper. It's your thing. So it is kind of it takes the onus off the group. That lowers I imagine it lowers the temperature of responsibility and angsting about someone not doing what they said they were going to do because it's on them. And it also kind of sets the pace, I think, for members who are like, wait a minute, Adam and Kim and, Rushi and Daniel, they're all trucking along here. It may be inspiring or encouraging when you see other people doing something. So it can also like role model good, healthy academic habits. So that's what I love about small groups. So I eating this stuff up. Love a peer
Yeah,
mentoring circle.
I do too. And yeah, and your WAGS example is excellent because if I were trying to write one group paper with a handful of authors and somebody falls through, then we're all sitting there waiting on them, or we have to kick them out and have somebody else do it. This is different, right? Each person's individual goals can be on their own schedule. And one of the things that we want, again, we wanted to balance that so that that complete individualizable schedule with a little bit of internal accountability. So just knowing that we're going to meet next Thursday and I said I would have my CV edited, okay, maybe I can make a half an hour to get that done. So it might help spur people along, hopefully in not too stressful a way, if that makes sense. So I think that was kind of the main roles and responsibilities, and I would encourage people who are going to lead peers in this kind of an effort to again just give everybody a lot of grace because we got so much else going on, and there are certain times of the year or certain times of our lives that are just busy. So then you get less done. It's okay if it doesn't matter to them as much, then it shouldn't matter to the rest of us that much. Um, okay, the next part was norms and values, which really relates to roles and responsibilities. And we sat down and we tried to figure out, okay, what are our what will be our expectations for these meetings? What is our expectation for attendance? Spoiler, there wasn't one. If they came, they came, and if they didn't, we knew that they couldn't make it. We had one of our members was an emergency medicine physician who, if she was post call or like post nights and at home, couldn't join us in person. And this was pre-pandemic, but we still had Zoom, thank goodness. So we just had her join us virtually. And even though these were often lunch meetings, she could have her lunch at home and join us still in our conference room and participate. So we tried to make the norm really was how do we make this as inclusive as possible for the people who really want to be a part of it? How do we avoid stigmatizing anybody who says they want to be a part of it, but then don't really do all the stuff, which every group will have somebody like that. And again, for reasons. And
And
then
also,
really,
Adam,
yeah.
what you're this democracy of allowing and being as inclusive as possible, I know can sometimes for faculty development folks like us be a hassle because you want to, especially me with my career mantra to build community. I love
Mhm.
being live in person. I think it's really important. And
Mhm.
recognizing that now many of us, as we mentioned earlier, have these growing, increasing, broadening footprints, and our faculty are not in the next building. They may be 40 miles, 100 miles, 200 miles away. They may be around the world if you're talking
Yep.
about our School of Public and Population Health folks who are traveling all over or living in other parts of the world. So yes, it's ideal if we can all share space in 3 dimensions, but if you can't, we have to be able to be accommodating to and be accessible to people who, if they're next door and they can't make it because it's downpour raining, or they're literally in a different time zone.
Well, and as a slight tangent, I have more recently joined a peer mentoring group of pediatrics program directors through the Association of Pediatric Program Directors, and they set up these small peer mentoring groups that have 5 or 6 program directors, and we have a virtual. It's all virtual. We're all in different states. We meet monthly. And sometimes only 2 of us are there. Sometimes we have to cancel them. Sometimes everybody is there. Sometimes we have a specific question to talk about. Sometimes we don't. And it having that, like you said, I'll use your word, democracy of people who are there or not there, and just knowing that there's a group of people I can email if I have an urgent question or just need to vent about something who have been there. And that's so valuable. And yet we only see each other in person maybe once a year at a national meeting. It's still really valuable to try to make that connection virtually. And I agree with you being very extrovert. I love being in person, but you're right. It isn't always feasible. And the technology shouldn't be a replacement for human connection in person, but I think it's a great augmentation when we simply can't be there as often as we want to with the people we need to talk to. So, so that was all part of our sort of norming process was how are we going to engage everybody as part of this group? In terms of documentation, we actually created and I'm pretty sure every institution has some kind of share secure file storage system. I'm just going to assume that that's the case. If not, you can use a Google Drive, which is free. We used, at the time, it was Box was what Baylor was using. Now they're using OneDrive and Teams. But whatever it is you're going to use, set up us, even if all the documents are just mirrored from your institution's intranet or publicly available stuff, set up your own place where just that group is going to be able to access documents. And you could start with just putting your institutional CV template or promotion pathways criteria or portfolio templates in there, which aren't personalized yet. But then what wound up happening was, as we started formatting our CVs, we began sharing them there with each other. As we began developing our portfolios or our education philosophies or our award applications, we started sharing them there so that other people in the group could see what we had done, how we had answered certain questions, how we had formatted certain experiences or accomplishments. And I think that having that there in a way that people can look, they can consume it on their own time. So we don't spend time during our in-person meetings reading. We spend that time interacting, and then it's basically a flipped classroom for adults, right? Or for people who aren't in classes, but to be able to have them access all of that material on their own time was really important for us.
I love a good repository.
Yeah, right. Who doesn't love a good repository? Um, and then then the next thing we did. So after we had done all of that, happened at our first meeting, by the way. So figuring out our roles and responsibilities, our norms and values, our documentation and repository plans, and that was all done in that first meeting. And then what we decided to do was, because it is the currency of academic communication, I guess, was we all needed a CV that was properly formatted. And I don't think I'm going out on a limb saying there are a lot of people out there who just don't make time to keep their CV up to date. I couldn't believe it when I learned that there were people who were like that, but it was like 90% of my colleagues. So I apologize that I misjudged how people do, but it's hard to make time for it when you've got lots and lots of other things going on. But we had people in that group who hadn't updated their CV in 4 years, and it wasn't in the Baylor College of Medicine format. Most of our institutions, I think, have a preferred format. We could have a whole separate podcast to talk about my opinions about those formats, but they're
let's not.
they're universally not very attractive, but you have to do it in order to promote yourself within the institution.
God bless the people who think that they'll update their CV at the end of the year or once a year.
Oh,
Then you inevitably have to go back in your calendar day by day by day to remember what was the name of that talk, where was it, how many people were in the audience, who sponsored it, why. Oh my goodness, every time I'm asked to do something or something's been submitted, I just put it right in the paper right then and there. I mean, put it in my CV immediately because I did that one time. I remember one year at Hopkins, I'm like, wait a minute, how did I forget the CV? And I literally had to sit there one weekend, day by day by day, because I could remember like three big places or three big talks I given, but I'd forgotten like seven or eight, regional kind of national things. And I was like, whatever, that's not a big deal. Turns out that's a big deal. And I forgot to add it and then I couldn't remember. And that just, you want to put your head through a window. So for the love of Pete, keep your CV on your desktop every week. Whenever you're asked to do something, just put it in there. And even if it's not done, like highlight it in red or make it all caps or some way to stand out to you the next time before you send it, you just change it. But that way it's so much easier as a tickler to remember to update it.
Yeah, and in fairness to people who don't have or don't feel that they have the time to go into the document and do that, I do what you do, by the way, so I don't necessarily have a different experience. But I do have a couple of colleagues who taught me some other ways that they keep track without updating the CV in real time. So I had one colleague who kept a paper Post-it document next to her computer and just jotted down anything that had to be added to the CV. And then every 3 months, she would go in and make sure it was updated. That worked. Another way to do it, if you're not on paper like some of us, is there's the Post-it note feature on your desktop on Windows. And so one of them actually had a Post-it that was constantly open in the upper right-hand corner of her second screen. And she would add things to that had to go on the CV. And then she would update it every so many months. So whatever the strategy is, I agree with you. Having one time gone more than like about a year without updating my CV, it was so time consuming to go find everything that I had. You're right. It's just scrolling through my calendar, looking through emails. Didn't I do this talk somewhere? My word to the wise is just, I think you said this too, is to just keep the CV updated, because you never know when you get an email inviting you to do something and it's like, hey, shoot me your CV. And you're like,
Oh,
oh, that's embarrassingly out of date. Now I have to spend an hour fixing it before the
oh,
interview. I
oh.
would much rather have a version that's within a week accurate and just be able to send it on. So there's two separate issues. One is keeping your CV up to date, and then the other one is making sure it's in the format your institution wants. Which
Mm.
again, for us, we were all new faculty. We were within 4 years of starting here, and some people hadn't actually formatted their CV to Baylor's format, which was its own problem. I encourage you, when you start in a new place, just do that right away. It's a pain. I'm not gonna lie. Actually, we were talking about AI before we started recording. I bet AI could help you
Oh.
move your CV from one format to another, but that might be a whole separate
And it would
pod.
give you a good start.
It
Here's
would
a
give you a start.
template. Here's
Yeah.
mine. Do it.
So what we did was we had 12 people. We broke into three groups of four, and we said, okay, for the next 2 months, those subgroups of the peer mentoring group are just going to meet and help each other get their CVs formatted. And again, there were people who moved slower than others, but the effect on me as a member of one of those groups was not that significant. We each formatted our prior CV into Baylor's format if we hadn't already, and then we passed them all to the next person in the group, who then critiqued it and then passed it along to the next person in the group who then critiqued it. And so those little groups, you got three other critiques on your CV formatting. And part of it was to ask questions about, okay, so an example would be, what if the institution's standard format doesn't have a place for social media, blogs, or podcasts like what we're doing now? Some institutions have an old enough template or an old enough mindset, frankly, where they don't have that. How do we fit it in there? And so sometimes we had to troubleshoot each other's questions. And then what happened was Ruchi and I, as the leaders of the group, would gather any questions we couldn't answer about the CV formatting, and then we would reach out to the head of faculty development at Baylor with questions. And actually, during one of those meetings, we zoomed her in so she could answer questions about CV formatting as well. So this all sounds really simple for people who are experts at maintaining their CV, but for us, it was a new process. And I try to teach this to residents now because I learned so much that I wish I'd known 8 years earlier. But I think that even though it seems a little bit trivial, we spent a lot of time on this, a couple of months at the beginning of the peer mentoring circle. Once we got done with that, once everybody, and 11 of the 12 people did complete a CV in Baylor's format. So that's pretty good. And then what we did was we moved on for the other really 8 months. Was we really looked at the pillars of the institution and developed our own portfolios that would help with an ultimate promotion application. And that can be really different depending on what somebody's own goals are. So if they were on that single mission pathway looking at a clinical promotion, or if they were on the typical dual pillar pathway and they were looking at like clinician educator as a pathway, for example, they would have different portfolios and different things to assemble. The other thing and this is specific to Baylor, is there are intramural awards that we can earn on those two pathways, actually. So there are early career and mid-career excellence in clinical care awards that Baylor offers. They are criterion based, so they're not competitive. If you meet the criteria, you get the award. So you build a portfolio, you submit it with some letters, and then a committee of faculty reviews it. And if you meet the criteria, you get the award. There are 4 education awards that work the same way, called Norton Rose Fulbright Awards. And there's one in teaching and evaluation, educational research, educational leadership, and educational materials development. And again, if you meet the criteria over a 5-year award, you can get the award. And so we actually spent a little bit of time working on those. And during the course of the peer mentoring circle, we had 4 people get educational awards of that sort, and we had 5 people get clinical excellence awards out of the 12.
Wow.
So that was pretty good. I mean, again, it's criterion based. They weren't competing, but it still takes months to write those applications. I've done it, so I know it's a lot of work. And again, this would be different for people in other institutions. You don't have those exact same awards. But if there are either internal or regional or national awards that you might be competitive for, this is a good opportunity in a peer mentoring circle to get feedback from people who are right there with you about the quality of that work. And those awards can help support your promotion.
Mm.
So then again, the portfolio piece, we sat down and we looked at research portfolios, we looked at educator portfolios, and we looked at clinical portfolios. And again, depending on the promotion you want, you apply with a different one, at least at our institution. This is going to be all very specific to someone's own institution. And for educators, for example, we spent a whole meeting sitting down and talking about designing an educator philosophy and developing a teaching portfolio, because that's what you would need to do an educator portfolio. We had another meeting where we sat down and looked over the portfolios for clinical excellence. We had another meeting where we talked through the research portfolios. There's a lot less of that going on with this primarily clinical faculty, but we wanted to recognize the different ways that somebody might be promoted. During the course of our peer mentoring group, or as a result of our peer mentoring group, we had 5 of the people in the group promoted to associate professor. One of them was already an associate professor. So he had joined us as Dan Cedillo, actually, the author you mentioned, was already an associate professor, but 5 of the remaining 11 got promotion from assistant to associate during the course of that peer mentoring experience.
Wow.
So we had, I think our outcomes were pretty good. And then, I've already kind of along the way told you these things, but the last step I mentioned when I summarized earlier was evaluation. You want to know how you're going to measure the success of your group. And so what we did was we knew that we might want to study and publish what we were doing. So we had IRB approval. So we had developed a survey, and we had looked not only at those outcomes I summarized, awards and promotions and CV completion, but we also looked at people's wellness. And in a survey we did of this admittedly small group, we found that people felt really well supported. They felt more comfortable with promotion. They felt like their work was more valued. And they really appreciated just having protected time where they could bring their lunch and tell everybody else to bug off for an hour, and they were just going to focus on this. I think protected time is a precious commodity, even when you get an hour of it. And so that's how we wound up sort of completing that experience. And so we did the first 12 months of peer mentoring through 2021, and then the next 2 years we actually just looked at how people did with their promotions and their awards over time. And that's the last part that was published in this paper and I'm not really proud of this, but of the group that didn't join our peer mentoring group, there were 159 faculty. 0 of them went up for a patient care award, 0 of them went up for an education award, and 1 of them got promoted to associate professor during that time. As a result of this work, I believe a framework emerged that then helped the remaining group of faculty. So this was all the data that we had as of almost 3 years ago now. Since then, our institution has actually paid for protected time for one of my colleagues to be a faculty development champion. She now liaises with the leadership in Houston directly and brings a lot of teaching materials for career development to our faculty. And our administrative office has really taken a lead in pushing people to be more direct about getting their promotions. And I'm one of our deans here. The other one here, who's responsible for faculty affairs, was able to create a compensation adjustment that now allows people to get a much better pay bump when they get promoted. And I think that provided a little bit of external impetus for people to seek promotion. So we've had a larger number of people promoted in the last 2 to 3 years than what I just cited.
Go
So those numbers,
Baylor. Wow.
yeah, I think of Baylor as a very forward-thinking institution when it comes to academia, and I'm really proud to work for them, actually. And I do have to give kudos to CHRISTUS Health, because they actually underwrite the costs of what we do here. So it's not like Baylor is paying all that money directly. And CHRISTUS really recognized the value. Again, I go back to what I said about women in engineering: success and retention. It costs a lot of money to replace somebody at the faculty level, particularly at a place like this where a lot of people have leadership roles, and replacing a leader is also expensive. So I think that there's a real, again, a forward-thinking attitude about how do we not only bring really great people here, but how do we keep them engaged, help them feel supported, make sure we're all aligned in our mission. So the institution has a mission. I can't be opposed to it. So we all need to be aligned together, and that's going to help me feel like I'm doing valued work, and it's going to help them feel like the people here are supportive of what's important to them. So I think it's win-win-win between Baylor, CHRISTUS, and our faculty. But I do feel like a lot of good came out of what we started with here.
Absolutely. Congrats. What a culture you've built. And yes, there's no doubt there is a significant return on investment in faculty development.
I'm preaching to the choir here. I get that.
Oh my gosh. Any way you measure it, it pays. So I applaud you and your colleagues' efforts at Baylor, and thanks to CHRISTUS too, absolutely, for seeing that investment. Good job. Love it.
Thanks. That's the summary. So I think that there, like I said, there's a few things that we did that were specific to our experience here, but I think creating a peer mentoring circle just requires a group of people who have some shared goals and a little bit of willingness to work together. And you can go through the steps I outlined, and I think that they would be really germane for any group that wants to accomplish or help each other accomplish their goals individually.
Thanks for that cookbook. It works. It works. Dr. Adam Wolfe, thank you so much for being on the Faculty Factory podcast. Again, we're going to get you back, and you're going to be featured at our upcoming leadership boot camps. Thanks for tuning in to the Faculty Factory podcast. We are a faculty development community sharing tools to build academic leaders in healthcare. Maybe you want to be interviewed on the podcast? Please visit facultyfactory.org/contact and send me a message there. The Faculty Factory podcast and website is sponsored by the Office of Faculty Affairs at the University of Texas Medical Branch in Galveston, Texas.